Hello, everyone. Welcome to Philly Forum. I'm Michelle Glaze, Director of Professional Outreach for the Foundation Fighting Blindness, global leader in driving retinal degenerative disease research. I'm really excited for tonight's Philly Forum. This is our first anniversary, and Philly Forum was the first cohort in our Foundation Forums for Blindness series, which is a virtual professional network of professionals serving the blind and low vision communities all over the US. And it's a way for professionals to come together to share resources and also to collaborate to provide a path forward for individuals with vision loss or blindness. Before we get things off, just a couple of housekeeping items. Tonight's session is being recorded, and we do have a number of presenters this evening. So if you are joining and you are not presenting, please mute yourself. Alt-A is the key command. If we do have a lot of interference, I may have to mute all the lines, and in that case, presenters will have to unmute. But we're gonna try to go ahead and move forward and leave all the lines open. So again, if you will just mute yourself if you are not presenting, please. The recording of this session will be housed on the Philly Forum page after the session has completed tonight. That page is located on the website fightingblindness.org. Click on For Eye Care Professionals, the tab, and then you'll see Foundation Forums for Blindness and Philly Forum will be listed there. I would like to thank all of our founding members. This is a team effort, and there's a lot of work that goes on behind the scenes. So I want to thank Beth Deering of VisionLink, Laura Swatko, Blind Institute of Technology, and Dr. Ranju Prasad with Will's Eye for all the work you do to make these quarterly meetings possible. And with that, I'm going to turn things over to Dr. Ranju Prasad. Thanks so much.
Thank you, Michelle. Do we have the slide? Okay. All right. Thank you, Shannon, for putting up the slide. Good evening, everyone. Thank you, Michelle, again for the introduction. I want to mention that there will be slides up, so everything that I will be saying there, I will be speaking. As Michelle mentioned, the Philly Forum is a dynamic virtual platform dedicated to supporting professionals working with the blind and visually impaired community in Philadelphia and its surrounding areas. We are incredibly grateful for the opportunity to spotlight essential services and resources, fostering greater awareness of the support available to individuals with low vision or blindness. Today, not only do we mark our one-year anniversary, but we also recognize February as Low Vision Awareness Month, as designated by the National Eye Institute. This month is devoted to raising awareness about the impact of vision loss, promoting vision rehabilitation services that help individuals maximize their remaining vision, and emphasizing the importance of detecting and preventing vision loss. Last year, VisionLink commissioned a study, Adults with Vision Loss, with the Research and Evaluation Group at Public Health Management Corporation. They found that through literature review and public use data analysis from 2021, that in Philadelphia, there are approximately 53,351 adults, approximately 4.3% of people aged 18 years or older who experience vision difficulty, defined as being blind or having serious difficulty seeing even when wearing glasses. This is greater than the national average of 2.8%. In line with FFB Low Vision Awareness Month and these findings, we are excited for today's meeting. Our agenda highlights a special presentation titled Diabetes Day, Increasing Access to Diabetic Screening, led by Dr. Alan Ho and the Diabetic Day team consisting of Dr. Nellie Shields and medical students Ari August, Arslan Humayun, Leah Prishak, Madison Woods, Chris Raimundo, and Rachel Kane. They will talk about raising awareness specific to the importance of annual diabetic eye exams, free screenings to help eliminate preventable blindness caused by complications such as diabetic retinopathy. Diabetic retinopathy is one of the leading causes of vision loss among adults. The same study that I had mentioned found that 4.28% of Philadelphians have diabetic retinopathy of all stages compared to the national average or the national rate of 2.89% and the Pennsylvania rate of 2.96%. Additionally, 0.95% of Philadelphians have diabetic retinopathy in a threatening stage. Therefore, the importance of such events and programs is crucial. Following the presentation, we will have a Q&A session led by Beth Deering, Chief Program Officer at VisionLink, discussing their services and resources available for those with visual impairments. We will then have our resource roundtable to hear updates from our forum guests about their organizations, followed by closing remarks from Michelle. I would like to now hand over the platform to Dr. Alan Ho and his incredible Diabetes Day team. Dr. Alan Ho is an attending surgeon and director of retina at the Wills Eye Hospital, and as well as at the Wills Eye Hospital, as well as professor of ophthalmology at Thomas Jefferson University. He has special interests in macular diseases, diabetic retinopathy, surgical retinal diseases, and clinical trials investigating new treatments for vitreoretinal diseases, including gene and cell therapies and new drug delivery devices and techniques. His accomplishments are extraordinary. He has authored over 325 peer-reviewed publications and several textbooks, as well as receiving multiple awards in his field. On to you, Dr. Ho.
Thank you, Ranju and Michelle, for the invitation. I'm glad you're all here. My first interactions with Foundation Fighting Blindness, actually, I was talking with someone today, were at a meeting called Retina and Cell Gene Therapy meeting sponsored by Foundation Fighting Blindness, focusing on really severe vision loss, mostly from inherited retinal degenerations, and talking about the science, the incredible science that's going on in cell and gene therapy. But we appreciate the invitation to talk about something that winds up in the same place, but not really as rare as Ranju's comments really just made me very aware that 1% of Philadelphians have vision-threatening diabetes, and 13% of Philadelphians have diabetes mellitus, higher than the national average. If you're a baby born today in our region, there's a 25% chance that you'll develop diabetes in your lifetime, and a 40% chance if you're born in the year 2030. Having diabetes mellitus. So it's the other pandemic. And coming back to the original focus of the meeting I went to, Foundation Fighting Blindness, focusing on severe vision loss from retinal degenerations. This is a very common problem, and that's our focus, is to try and eliminate preventable diabetic blindness. It's a very multifactorial issue. It's not just a health issue. It's ironic because we have better treatments in ways to prevent diabetic blindness, and yet we spoke about population figures, but on an individual level, I'm reminded of the day Nellie Shields was in my clinic and just said, why is this happening? Why are they going blind? Which sparked Diabetes Day. Just this weekend on call, we had a 50-year-old dad, Jose, with children, monocular, lost one eye already to advanced diabetic retinopathy, and now losing his only eye. So I think we're blown away by the population statistics, but it's the mission moments that we see in clinics, that we see where working age adults are losing vision, that has inspired this particular movement that is now expanded to Temple and Shea, our great partners, and now even beyond. We have some other out-of-state listeners, I think, tonight, from California and from Texas, some of whom represent leadership at over 300 retina doctors across the country that were kind of interested in learning about the playbook and the mission here. So with that, trying to tackle a very complex health and socioeconomic problem by just simply starting somewhere. And that's how this started in 2022. I'll turn this over to Nellie Shields, who will give a little background, and then our great other students like Ari and Leah and Arlson and Madison and everybody else that you spoke to. I'm sure I've missed some people, so I apologize. Nellie, take it away.
Thank you for the introduction, Dr. Ho, and thank you again to everyone for having us today. We're excited to talk about our initiative and collaborate with other initiatives as well. Speaking of call this weekend, I actually was also on call and had a patient present with NLP vision because of diabetes. And this patient, sort of like the initial patient that kind of sparked Diabetes Day, the primary issue was insurance, the reason he was unable to get to care in time. And at the time I saw him again, it was NLP vision, which is extremely unfortunate. And just another reminder that it's not just the one story that started this, but there continues to be stories every day, every week in our clinics on call where we see patients with similar conditions and unfortunate outcomes. But kind of turning the leaf over, we're hoping to eliminate a lot of this. So how Diabetes Day began, as Dr. Ho mentioned, it was in 2022. I was shadowing him as a medical student, and we sort of turned to each other and asked, why is this happening when we have all of these preventative and great treatments kind of circulating in the market and with the clinics? So the patient that actually initiated the Diabetes Day was another patient who did not have access to insurance, and that was the reason that they couldn't access care in time. So we started as a single event at Wills Eye Hospital during that year, 2022, and then momentum grew and it evolved into a citywide initiative, expanding to include institutions such as Temple and Penn. And again, the momentum continues to grow, and now starting with our upcoming spring event, we're having institutions across the state of Pennsylvania, hoping in the future to extend our borders beyond Pennsylvania. But that's sort of the direction that we're heading right now, and we're all very excited. Overall, Diabetes Day is a collaborative effort between not only physicians and students, but also technicians, opticians, community volunteers, sponsors, and many more. Together, we sort of all work together and identify and treat this preventable eye disease in our local community. But I'll kind of hand it off to the next slide and whoever's going next.
Thanks, Nellie. Yeah, I just wanted to reiterate kind of the goal, basically what everyone has been saying. First and foremost, our goal is to treat diabetic retinopathy and prevent it, early blindness as much as possible, specifically in our Philadelphia population. And as Dr. Ho said, it is a multifactorial problem. There are a lot of things that go into this issue. And as such, we're aiming to meet each of those needs through a multifaceted approach as well. So really the day, it just culminated in a day where we not only screen patients, but we also provide educational resources, connect patients with other healthcare services, and most importantly, ensuring that follow-up and adherence. That's a big problem we faced in the past, and each year we're working to find ways to increase that follow-up and adherence. And as always, we're trying to, increase our community engagement and look for ways to improve. As Nellie was saying, it's really spread into a community-wide initiative, which is a really wonderful thing. And we're always looking for ways to continue this momentum moving forward. So. We can pass it off to the next person.
And so part of our mission is to kind of expand this event, not just so that it has impact on the people that we see here in Philadelphia, but so that we can kind of expand the mission across state lines, like Nellie said. And so something that we've implemented is this playbook. We've designed this so that we can kind of disseminate our ideas and our process for how we make Diabetes Day happen at our institution. But our main idea is that this is something that should be tailored to each individual institution based on the resources that are available, based on your specific patient population's needs. For example, we find with advertising that our local TV ads really reach our target population super well, fills up our patient slots, but other things like event flyers, which weren't as successful in Philadelphia, might be great for a tighter knit community that frequents the same places. So we've designed this playbook of kind of the different pillars to creating an event. Oh, sorry. My fire alarm in my building's going off. I'm so sorry. Nellie, could you take over from here?
Oh my gosh.
Are you on, is there a fire? Do you need to go? Because you should go.
No, it happens like 5 times a week. It's just it's an apartment issue with the apartment complex. I'm so sorry.
Make sure that there's no fire. Please double check.
Which bullet point are you at?
If everyone can mute,
The Ludlow.
you're not speaking.
Which bullet point?
Okay.
Okay, so yeah, I'll start on patient scheduling. So we have a HIPAA compliant patient self-registration system. We use Qualtrics, and that's so that the patients can sign up. It's HIPAA compliant, and then we can keep track of the number of patients that are coming. But typically on the day of, we also like to welcome walk-ins if possible, if we kind of have the capacity at the time. We also have waivers that acknowledge that the event is a screening event and we can't do a complete ophthalmic exam, which is important because we don't want patients to be relying on our event for their annual eye exams. We do want them to follow up and continue with care. And the other thing that's really important is sending staggered reminders to the patients beforehand so that we increase compliance. That includes text messages, calling patients, and that's why we have our wonderful team of med students, and they will be helping us out with that closer to the event. And then finally, our advertising, we'll show it at the end, but there's an event flyer with a QR code for the patients to sign up, also a URL, and we're working on advertising to different communities across Philadelphia. Our main goal is to try and access patients who are not connected with insurance, because those are the patients that are most at risk and least likely to seek care, as we kind of talked about in a few examples already today. And so although that's an ideal standard, it's sometimes difficult to identify and reach those patients. We have a list of a bunch of different programs and community outreach areas where we're trying to find these patients. And so that's sort of a work in progress on how to increase the number of uninsured patients to come to our event. And then finally, involving local diabetes providers in patient recruitment. So finding primary care providers, things like we're trying to, this is more related to other things, but we want to get podiatry in this year so that we're not just focusing on the diabetic retinopathy, but also other systemic things related to diabetes as well. I think we're done with this.
Right, so just going over what the day in general is going to entail. So first, the patients are going to check in and they'll sign a consent form, and they'll get paired with a patient navigator, whether this is a student volunteer or a translator, and that person will stay with that patient throughout the entire day, which is awesome because then they can help direct them to where they need to go and just answer any questions for them. After that, they're going to be receiving ocular vitals and as well as imaging, and if needed, they'll get a free pair of glasses ordered. And then after their imaging and their exam, they're going to get a review of their results as well as their follow-up plan. And this is also where they'll get a free healthy box lunch, as well as some really valuable resources, such as talking to nutritionists and getting connected to social workers and getting skin checks as well. And then after the event, we're going to make sure that there's a very smooth transition between getting them connected to follow-up appointments, whether that's with a primary diabetes care provider or getting an ophthalmic follow-up, and that's going to be free for them. And again, just tying back into what our goals are, this is going to really help patients who might be facing financial barriers to care. I think we're ready for the next slide.
All right, thanks, Madison. Yeah, so Diabetes Day is a snapshot in time of the population we're able to learn about. But then how do we use this opportunity to collect information that can help us apply different interventions, throughout the whole year, or to other diabetes days. So we kind of boiled it down to 5 research objectives. It's a growing list, but kind of the ones that we're focusing on for the upcoming Diabetes Day. Some patient knowledge assessment. That's kind of, is it something about the knowledge of diabetes, the disease, that's preventing them from routine eye exams? Is it maybe health literacy, where the patients might know what diabetes is and the damage it could cause, but just aren't aware of the full severity of the impacts, or barriers to care? Is it just simply the insurance or transportation? And then trust is something that I think is a little bit unique, looking at, is it maybe they know all the facts, can get to the clinics, but just, trust is just something that they're lacking. And then how do we build on that trust to, bridge that gap? And then lastly, looking at the impact of the community screening programs themselves, such as the playbook, and seeing how we can modify it in the future to, improve it and make it more most effective. So you can go to the next slide. So just looking at some of the data from the past 3 years of Diabetes Day, so that 4.3% number that we showed in the first about the number of patients in Philadelphia, it kind of stands out when you compare it to the 9% of positive screening on Diabetes Day. So it looks like it is targeting the right population, getting them in the door. But of course, that is only one of the disease that it catches. Looks like there's 38% of positive incidental abnormalities, glaucoma, retina detachments, ERMs, macular degeneration. So that's another component to this, where knowledge of not just diabetes, but improving vision loss through incidental findings and making sure that there's follow-up there. And then just wanted to show the distribution of insured versus uninsured. So really capturing the whole of the population. Yeah, you go next slide.
So as both Nellie and Ari mentioned, one of the most important aspects of Diabetes Day is actually making sure that we're reaching our target population, and that really is in the meat of advertising. So we really want to be reaching underserved individuals in Philadelphia and the surrounding area. And as Nellie mentioned, as Nellie and Ari both mentioned, news outlets, press releases, they have a really big impact in gaining a lot of attention and recruiting a lot of patients. But we also want to target these local communities as well. So we have flyers that we have in 5 different languages, and we distribute these flyers to local community health partners, diabetes providers, local shelters, and we also distribute these flyers through social media to target both a large scale and our local community that really is underserved. In addition, in order to recruit volunteers to actually make our event work, we use social media, physical flyers, and school interest groups too. Go.
So with that, I'll quickly jump into how you sign up for Diabetes Day. And since we are a growing event now currently at 3 major sites, we have separate flyers for each of those 3 locations. And we have them here. On the left is for Will's Eye. Temple is in the middle, and Shay at Penn is on the right. Will's and Penn both have QR codes that you might see in the bottom right, which you can sort of scan with your phone. And you can sign up that way. They also have an email and website information at the bottom right that you can use. And then Temple in the middle has a phone number that you can call to set up an appointment for your screening. As Michelle mentioned at the top of the hour, this meeting is being recorded and will be uploaded on the Philly Forum Foundation Fighting Blindness website. So you can always refer back to these flyers through the recording. I'll also put these flyers in the chat so that you can share them with anyone who might be interested in attending the event, which will be on Saturday, April 26th in the morning. You can share them with patients. You can share them with members of your community at other events, awareness events such as this, wherever you sort of see best fit. And if anyone ever wants to get in touch, if you have any questions, suggestions, concerns, anything, I'll also put my email in the chat so you can reach out to me and we can sort of move forward with next steps from there. I believe we might have a few minutes. So with that, I wanted to thank everyone and move to the next slide, just with any questions or feedback or suggestions for promoting the event. And just want to thank you all once again for taking the time to attend this event and for listening in.
This is Beth Deering from Vision Link. I want to thank you all so much for sharing this information with us. We are very fortunate that we've been able to participate in the event for the last 2 years, and it is an incredible event. We definitely want to support growth in however we can at Vision Link. We're very excited to be there again this year. And we will certainly share this information within our networks, with our clients, and make sure that we can support in that way. Thank you all again so much for being here and sharing this. We'd love to open it up. If there's any questions anybody on the call has, this is a very great opportunity to ask the experts.
I see Ari on the call, on the Zoom. She must mean that there's no real fire going on.
There never is. There never is.
Yeah, until there is. So we play defense. And I just want to say, I mentioned some of the students. I want to thank also Rachel and Christian and Addison for doing a great job as well in Oralson. So yeah, a very complex problem, a very common problem, and we're kind of just what I appreciate about the students and the trainees is the energy and enthusiasm, and the academic questions are aimed toward trying to do this better, trying to get to populations better, trying to focus the needs through the experiences of the patients, and we appreciate the partnership, and hopefully we'll continue to grow it beyond Pennsylvania. One of my colleagues is involved in Pennsylvania Academy of Ophthalmology, and they want to create a state proclamation for April 26th being Diabetes Day. So from a selfish standpoint, I get to work with a lot of very talented people, and for those of the places, the practices, the academic institutions that are thinking about whether or not to do this, there are selfish reasons to do it, and that is great energy, great team building, right in your own wheelhouse of expertise. It's a halo on the organization. I think there's a lot of win-win-win, above all for the patients, but also for the organizations that serve. So thank you for the opportunity. And unfortunately, I have a simultaneous board meeting that's going on right now, so I'm going to jump off. But
thank you so much, Dr. Ho.
Okay.
We do have a question in the chat I would love to address. So somebody asked, regarding barriers, have you been able to connect with consumers who are homebound? Dr. Ho, if you have to go, thank you again so much for being here. I'm sure your team can tap in and help answer some of these questions if that's okay with you. We don't want to keep you longer than we have you. Thank you.
Just want to clarify what you mean by consumers who are homebound.
Would the person who asked the question like to ask, or should I assume?
Thank you. Hi. No, I just wanted to clarify because I work with many individuals who are older adults and are not able to get out and about and could benefit from this.
Yeah, I understand what you mean now. So individuals who are like at home and don't have access to, get to Diabetes Day. That's a really great question and something that we haven't necessarily addressed. We have discussed in the past for individuals, say in farther areas of Philly, considering in the future maybe getting a bus or something that can bring people. However, that's never been addressed, and that's a really, really good thought.
Right.
Do you
Thank
have
you.
any ideas on how we can, or any ideas in the future if we were to address that? Any suggestions? That would be really appreciated. We'd be interested in trying to implement them.
Thank you.
I think that right now, one of the parts of Diabetes Day that would make it difficult to translate to getting it out to patients who are stuck in their home or not able to travel to a place that has the right imaging is we do use imaging to screen the patients for diabetic retinopathy. So instead of using a full dilated exam that they would get at an eye doctor's office, instead, they're getting undilated imaging so that doctors can take a look at kind of what the back of their eye looks like and then make a plan from there. I think that it would be, they do have handheld imaging that might be interesting to think about and look into to see if there is a way to get those handheld devices to patients who wouldn't have otherwise access to that care. And then the only thing with that is we would also need to really consider how follow-up care would be managed, because screening patients for diabetic retinopathy is only valuable if those patients can actually get treatment for it. So it's kind of a dual-edged sword there, right? Like we need to increase the access to care as well as the access to screening.
I think we have another question, Julie McNair.
Hi, I guess my question is to piggyback or follow up on the previous question with regards to the screening, the diabetic retinopathy screening, and doing community events. First of all, I just want to say I think what you guys are doing is great. It's something that's very much needed for the populations within Philadelphia County. However, what I gather is that these events are held at the facilities. And sometimes, as I said, you have underserved populations who either because of transportation or whatever reasons may not be able to get to the facilities at the time of day that these events are held. My question, I guess, would be, have you considered, or is there any consideration in the future, I guess maybe making it a mobile community event, something like that, as opposed to the individual's patients coming to you during that particular time, bringing it to the community to have a community outreach type of event for those people who would like to do it but can't.
I think that's a really great point. And one thing that just sort of popped into my head was, I mean, the technology of telehealth and how we could have something simultaneous, maybe like an asynchronous or asynchronous telehealth situation where the doctors who have signed up to volunteer for Diabetes Day, in addition to reviewing images for our patients, could also review whatever's happening at satellites and being sent in. I think that's a really important and missed area that we're not targeting yet. But a very good point. Ari, do you have any other thoughts on that?
That's basically it. But if you're looking to collaborate with maybe community organizations that would be willing to collaborate with you guys to engage in some type of event. I work with the Pennsylvania Link to Aging and Disability Resources, which basically is along the platform of what Philly Forum is all about. But instead of just focusing maybe on just one aspect, what we do or how we operate is connect people, individuals, organizations, whether you're a senior, a person with a disability, or a veteran, to the various resources or things that may be happening within your county that's local, as opposed to coming to a facility. So if there's opportunities to collaborate at some point in the future to perhaps coordinate some type of community event, that would be great.
That's a great idea. And I know even like a lot of primary care offices have imaging modalities, and that's something that can sometimes be sent to the retina doc. So I think with regards to that, telehealth would be a great sort of key component.
Absolutely. So keep all parties engaged. and reduce those numbers of diabetic retinopathy in the Philadelphia area. Thank you.
Any other questions or comments before we move on into our resource roundtable? Looks like maybe Laura. Hi, Laura.
I have a question. I'm sorry. I don't do Zoom. I'm not seeing where you could raise your hand. I'm used to Google Meet, so my apologies.
That's okay.
Question. I don't know if Michelle could do this or somebody. Can we get like a link that we could put this out on our LinkedIn page? Something that advertises this event, so I could, put it out on LinkedIn. If anyone has maybe that information for the event.
We can give you both a flyer. We could also give you the Qualtrics link for the patients to sign up. And then there's also a QR code, which has both the flyer and the link. So we can kind of make sure we send all of that after this.
Okay. So Michelle will get it and distribute it, or how will we?
Yeah, this is Michelle. If this team will maybe Ursula, if you want to be the point person to send me whatever information would be important to share, when I send out a follow-up email with a link to the recording, I can also include that information that will go out to whomever attended tonight's session and folks that were invited that were unable to join as well.
Okay, thank you.
Mm-hmm. Good question.
Great. Well, thank you so much. It's, sometimes with no questions, you're like, is that a good thing because I gave every bit of information they could possibly need, or is it just a quiet night? But we're so grateful for all the information you've shared, and we're really looking forward to supporting you in this, making sure that these events are really highly visited, and we can offer the resources that we have available both through this network and the Philly Forum and our own organization. So thank you again so much for being here. We would love for you to stay on if you have the time to stay on. We're going to have a resource roundtable, give some of our community partners that have presented in the past an opportunity to just talk a little bit about their organization, ways to get connected. A lot of this information we feel would be really valuable to your patients. So we would love for you to explore past presenters, ask questions today. We're happy to connect you directly with some of the providers that you feel would be really beneficial to you and your patients. So am I next, Michelle? Yes, right? I think that's
okay. Take it away, Beth.
Thanks. I kind of already took it, but thank you. So I'm Beth Deering. I'm the Chief Program Officer at VisionLink. VisionLink is an organization right here in Philadelphia that provides skill training, independent living skill training for individuals at any level of vision loss. We also have a low vision center at our new site, which we're really excited about, where we have the opportunity to work with clients to learn how to utilize low vision devices that they're prescribed by their physicians, explore new opportunities in assistive and adaptive technology, receive vision rehab therapy, as well as low vision therapy. We have an orientation and mobility specialist on staff, as well as 2 access technology instructors. We also provide an environment for individuals to prevent isolation and get social support. So support groups, a lot of opportunities to network, build a community, offer each other, information from lived experiences. We do also have a community provider training and a community education network where we work with different community providers to ensure that they're meeting the needs of their clients who may be experiencing vision loss. So we work based on work with the organization based on the population they're serving to ensure there's sensitivity, understanding, best practices, things like sighted guide that are incorporated into their procedures to ensure that when individuals reach out looking for resources, they have a network of providers that will be prepared to serve them, appropriately and in a sensitive way. Finally, we offer a wide range of resource and referrals. We have I think at this point, about 65 community providers that we have relationships with, where we kind of field those questions, calls, concerns from individuals looking for services to ensure we can provide a warm handoff. If somebody reaches out with food insecurity, if we have individuals come to us that have diabetes, are looking for more information support, we can refer them to the appropriate medical centers, and kind of everything in between. So we're really excited to be on this call, work with the number of providers who have committed to really getting their resources out there. And at this time, I would love to identify any of our previous speakers. Oh, I also want to mention that Melody May, our Director of Programs from Vision Link, is on the call as well. If there are any program-specific questions, she and I are happy to answer them, happy to answer any questions about Vision Link. But I do want to make sure we have enough time for anyone else on the call. I do know that Julie is here. Julie gave her a little intro to who she is and what she does, but Julie, if you would like to briefly share, a little bit about yourself and the organization and ways that patients and clients can connect.
Sure. Thank you, Beth. Again, my name is Julie McNair. I am the coordinator for the Pennsylvania Link to Aging and Disability Resources in Philadelphia County. Basically, the Pennsylvania Link kind of works the same way as this Philly Forum process is. I'm not going to say we're a direct provider, but we work with seniors, older adults, people with disabilities, people with all abilities, basically, at income levels, to help folks learn about the resources that are available within Philadelphia County. And not only learn about them, but also connect to long-term services. So there's the two-part piece of that. Primarily how we work is through collaborating with other agencies and organizations within Philadelphia County. I'm pleased to say that we do have a relationship with Vision Link, which we're very happy and proud of having that connection, which kind of opened the door to that question that I asked in the beginning about how to bring this to the community. As I said, there are to bring this Diabetes Day and the retinopathy to the community. I'm probably speaking a little bit out of line or maybe a little in advance, but it would be exciting to kind of collaborate with Vision Link, the organizations that are doing this, Temple, Shea, Penn, to kind of come up with some ideas as to how to, maybe in the beginning on a small scale, how to bring this to the community for those individuals who need the services that you're providing, but for whatever reason are unable to access or to get to those events at the community level. So that's, as I said, there are multiple levels to all of this, and I'm just trying to keep it very, very simple and short. But that, I think, is something that would be worth looking into, collaborating at some point in the future. I know this year we're may already be in planned, but that's something that I think would be beneficial to the populations that we serve. So looking forward to connecting again with Vision Link, maybe to discuss this more in some more detail, maybe develop it and see what happens. Do you have questions for, before I go, I have my colleague also on the line who's Carrie Gottlieb. Carrie Gottlieb can bring another piece of this because not only do we work with the various agencies and organizations to break down those silos, because sometimes we start thinking along our silos of what we do. But one of the missions and the goal of the link is to break down those silos so that individuals who are approaching the various organizations, they don't have to tell their story a million times. They can just come and connect with one place and connect with the resources that are available and get the necessary help that they need. So if you don't mind, I would like to just have Carrie talk just very briefly about his role with the PA Link.
Thank you for that introduction, Julie. Yes, I wear a few different hats. One of them is representing the Pennsylvania Link at the Philadelphia Corporation for Aging. I do what's called person-centered counseling, which is available to people who are 60 or older, or for people 18 and older who are living with disabilities. It's an excellent tool. It's a way of connecting people to resources in the community, public benefits, various resources that people may not be aware of. Often enough, people reach out to the senior helpline at PCA, and they need more than just a quick phone call. They need to have an extended conversation because there are various resources that many people aren't even aware that exist in the community. So just to piggyback on what Julie was saying, yeah, it's just a way of helping people realize, yeah, one thing, we have the no wrong door policy. So whomever comes my way, they're welcome to stop by. I'm in the building Monday through Friday, and I will leave my contact detail as well as my any questions that anyone might have for us. Any questions? But I also work in the resource center at PCA Monday through Friday. So we are there for walk-ins or for anyone who wishes to reach out. I'll leave my phone number as well. And I thank you.
Thank you so much, Carrie, and thank you, Julie. We're so thrilled that you could be on the call. I know, I realize I should have said this at the beginning. It's President's Day, and a lot of people are not working or they're out of town. And we planned this before we realized the date. So we're really, again, so appreciative that everyone is here tonight. That has limited the number of some of our community providers who were able to join us this evening. I do want to make sure that I'm not missing anyone on the participant list that is on the call to share some resources or information on their organization. Is there anyone on the call that I have not introduced or brought up yet? Okay. So I do want to just take this time then, for those who are joining us for the first time, to just share who some of the past presenters were. All of this information is on that Foundation Fighting Blindness Philly Forum link that Arsalan dropped into the chat at the beginning of the call. So you can get direct information, direct links to the organizations, but it can give you a sense of the types of resources that are out there and the organizations that are committing to sharing this information with the community. So we've had Dr. Erin Kenny from SALIS. We've had Alexander Shea from the Bureau of Blindness and Vision Services with the state. We've had representatives from Tech Owl. Thomas DiGustino has been here to talk about the services that they're doing at Temple's Tech Owl. Kate Pryor, excuse me, from the Legal Clinic for the Disabled came to talk about services that are available. We also had Alex Cohen from Accessible Pharmacy Services come and share with us a few times. They offer a wide number of support services outside of the pharmacy services that they provide, including diabetes information and support. So we will certainly make sure that they get the information that you have shared with us tonight so they can pass it along to their patients. Overbrook School for the Blind, Best Work Industries for the Blind, the United States Association for Blind Athletes, ArtReach, the Free Library of Philadelphia, the Pennsylvania Client Assistance Program, and of course, we've had Pennsylvania Link, PA Link with Julie and Carrie have come in the past. We are so excited to have this opportunity on a bi-monthly basis to invite organizations to come and share resources, and we look forward to continuing this in the future. So if you have organizations that you'd like us to connect with or partner or spotlight in this, please reach out and let us know. I will hand it back over to Michelle or Dr. Prasad at this point.
Actually, I just wanted, Laura, could you introduce yourself to the group here and the work that you do with Blind Institute?
Oh my gosh, I'm so sorry, Laura.
Oh, no.
It's because I know you and talk about you constantly. I just breezed by. My apologies, Laura.
problem. Hi, my name is Laura Swatko. I work with the Blind Institute of Technology. We're not a Pennsylvania organization, but we are a nonprofit that works with professionals that have disabilities, and we're a nonprofit staffing agency. And so we work with professionals, and a big part of what we do is work with the blind and low vision community. And everything we do is virtually. So just a little bit about, what we do. We help people that have disabilities find careers in throughout technology. So we are, if you're familiar with the software company Salesforce, we're the official training provider for Salesforce globally for persons with a disability. And we have training programs that are complementary to the community in Salesforce administrative work and also in digital accessibility. So if any of you, especially in the medical community, we really like to get the word out about our organization, and would be happy to, I don't know, Beth, I'm sorry, like I said, I don't do Zoom. And I don't know if you could possibly put, our web address in
Absolutely.
It's just blindit.org. That would be super helpful. And I'd be happy, I don't know if you want to put my email address, and I'd be happy to talk to anybody about the work that our organization does. And we also, one of the things that's happening that's occurred in the past 6 months is we got a very large grant from the Department of Education. And we're really happy to say that the money had left the Treasury prior to January 20th. So we're not concerned about having those dollars, that they won't be taken back or be stuck. And they are to help people in our community through apprenticeship work. So if anyone possibly at their organization would be interested in having an apprentice through Salesforce, or for digital accessibility of their website or forms or an app, be happy to talk to you about that.
Excellent. Thank you, Laura. Did anyone else have any comments before I kind of close things out? This is Michelle Glaze. Okay. Well, I want to first say thank you to our founding member team, Dr. Prasad, Beth, Laura, thank you so much. Dr. Ho, thank you for your presentation. Arslan, for your help in pulling all of this together, and for all of the presenters that shared about Diabetes Day. It was just an excellent way to bring the community together. Before I close things out, I do want to invite Shannon, who is our community manager for the Philadelphia chapter of the Foundation Fighting Blindness, to introduce herself and share any comments, and then I'll close things out for the evening. Shannon, did you want to say a few words?
Thank you, everybody, for joining us tonight. It's so exciting to see everybody come together and with the work that we're all doing and sharing it for others to pass along. As Michelle said, I'm Shannon Capper. I'm the community manager for the Philadelphia and Pittsburgh chapters for the foundation. I'm excited to be here. I've been here about 3 months now. And what we have coming up is, keep an eye out. We're going to be doing a vision connection coming up soon in maybe May or June. So if you'll get information from me on those, and then we're going to be hitting the ground running for the fall, for our fall vision walk, which I know most of you are all partners with us for that. So I'm excited to meet everybody and get that going. So thank you for all that you do, and we appreciate your partnership with us. Michelle, back to you.
Okay. All right. Well, as I mentioned, this session has been recorded. We will clean things up and get it posted on the Philly Forum webpage, which, if you missed it at the beginning, if you go to www.fightingblindness.org, click on the For Eye Care Professionals link, and then you will select Foundation Forum for Blindness Philly Forum. All of our previous recorded sessions are housed there. Our founding member team contact information is there, and contact information for all previous presenters. So there's a running list of good information. It's a great spot for professionals go to find resources in the Philadelphia area for their patients, consumers, clients with vision loss or blindness. Again, I'm Michelle Glaze, Director of Professional Outreach for the Foundation, and my team really comes together to empower eye care professionals to provide knowledge, community, and hope to individuals with vision loss due to a retinal degenerative disease and their families. We're excited to be able to bring together a resource sharing opportunity like Philly Forum, and there is a lot of other educational content for eye care professionals on our For Eye Care Professional webpage. If you need to contact me, I can be contacted at mglaze@fightingblindness.org. I look forward to our next Philly Forum, which will be in May. And the date will be posted on the Philly Forum page. So thanks again to all participants, attendees, presenters, and our founding members. Have a good evening.